Hi, my name's Liz Farrington. I'm a consultant nurse for hepatology. Now, when I talk to people about liver disease, one of the first things that tends to come to people's minds is that of alcohol. But there are many other reasons for having a liver disorder. And one thing we've seen an explosion of over the past decade is something called non-alcohol related fatty liver disease, or NAFLD. Now, NAFLD is a preventable disorder which is in the majority associated with lifestyle factors. So in particular obesity, and with obesity comes a predisposition sometimes for metabolic disorder, which can include diabetes, high blood pressure and high cholesterol. Now, having one or all of those factors can put fat on the liver, which over time can lead to inflammation, and it's the inflammation that can lead to scarring of the liver. And some patients can develop irreversible cirrhosis, and a proportion of patients will require liver transplantation. Now, one of the big issues around liver disease is that in general it's completely asymptomatic. So the damage is happening in the background, and sometimes patients are completely unaware until things are too late and the liver goes into failure. So it's really, really important that our main priority is that of preventing liver disease in the first place. So what we'll be doing is we'll be offering a green prescription which you can sign up to, and this will give you for 3 months a weekly vegetable box, and around that lots and lots of tips for healthy eating and exercise. You are the best people to treat yourselves. And what we're going to be doing is we're going to be following you up at the end of the 3 months and performing a specialist scan called a FibroScan, which hopefully will show a reduction in liver scarring and show the good work that you've put into your healthcare.
Hi, my name's Jenna Davis. I work for the Royal Cornwall Hospital, and I'm here today to talk to you about healthy eating, good nutrition and a well-balanced diet. First, we're going to have a little look at what we call the traffic light system. So most products now are going to be labelled with red, amber and green. That's just going to help identify the more healthy foods and the ones that are a little bit more risky with regards to high fat, sugar and salt content. So you want to be aiming to have as much of the green and the amber as you can, and a few of the red as you can. So in your packs you're going to find this Eat Well guide. This is ideal to pop on your fridge, on your cupboard, anywhere that you're going to be preparing your meals. And this is just to help give you a little bit of direction around the portion and food groups that you need to help sustain and maintain a really healthy and well-balanced diet. With the food groups and with the portion sizes, they don't have to be accurate every time, but try and sustain really nice balance throughout the day or throughout the week, because obviously portion sizes will vary a little bit depending on what you do actually decide to put on your plate. So we're going to start with fruit and vegetables. Ideally you want to be having about 5 portions a day, and it's really important to have a mixed variety of fruit and veg. Your body needs lots of vitamins and minerals to sustain itself and to keep itself nice and energised, and fruit and veg is exactly where you're going to get that from. So you're going to be having your fruit and veg boxes delivered once a week over the next few months, and you can also add to that yourself with popping along to farm shops to get a bit more variety, cans of fruit, dried fruits, frozen fruits, etc. So it'll really allow you to mix things up. So next we're going to be looking at starchy foods. You want to aim to have about 1/3 of your plate with starchy foods. This is a really important process that your body can make energy and keep you well. Now for most people, typically half their plate might be full of white starchy foods, so potato, white pasta, rice, bread, cereals. And this is a really easy transition to make. Ideally what you need to be doing is swapping over to your whole grains and whole meals. So your wholemeal grains, your breads, swap over from your white pastas, white rices to your brown. It's a really easy transition to make. It tastes just as good, it's just as easy to prepare, and it should be just a very straightforward, healthy, tasty option. So dairy and alternatives, try and aim for low fat, low sugar items, avoiding the high full fat milks and creams if you can. For your fortified dairy alternatives, it's a fast option that you can find now. Supermarkets, farm shops like this, lots of soy, almond milk, cheese, yogurts, etc. So you have a really sustainable alternative if you need to. Next we're going to be looking at protein. You can get lots of protein from various amounts of food sources, including fish, eggs, lean meat for example, pork without the fat on, look for turkey and chicken but just have that skinless. Try to avoid red meat on a regular basis, and if you can take processed meats out of your diet completely, that would be ideal. As alternatives to meat, you can have more beans, pulses and lentils. Ideally you can try and incorporate fish into your weekly diet, usually around twice a week. And if one of those portions could be an oily fish such as mackerel, tuna, etc., that would just help keep your omega-3 levels up and keep you on a nice fine balance with your health. So oils and spreads, you want to keep these as small variable amounts as you can, and aiming for unsaturated oils and spreads. So that could be rapeseed oil, olive oil, sunflower oil, but just concentrate on those being unsaturated if you can. And then having a little think about condiments and treats. Ketchups, mayonnaise can be quite high sugar, high fat, so if you can find the more healthy, lower fat, lower sugar options, but either way try not to have those on a daily basis. You want to keep those to variable and minimal amounts. And obviously with treats, we do all like a treat, but we don't need those to help us keep us fit and healthy, so if you aim to have those maybe once or twice a month or as close to that if you can, that would be ideal. So hydration is a really, really important factor to think about. We should be drinking about 6 to 8 glasses a day, and not enough of us do. Not everybody's going to be particularly thrilled with the idea of drinking just water, so you can incorporate sugar-free drinks, tea and coffee, but try not to make your overall daily intake dominated by caffeine. You want to find a nice balance between the two. A good couple of tips is that you have a glass of water or a sugar-free drink before your meals. That will help aid digestion, reduce bloating, and it will fill you up a little bit quicker. And by keeping yourself nice and hydrated throughout the day, you're less likely to have those unwanted cravings and hunger pangs. When we're dehydrated, the brain can send a signal to the body telling us that we're hungry. That can lead to an unnecessary binge on treats and snacks and things that we don't want to. So stay hydrated throughout the day, and hopefully you'll have a lot less of those to deal with. So now that you've got this new information and you're receiving your fruit and veg boxes every week, now's the time to pull out your old cookbooks, go online. There's a wealth of information with regards to easy cook recipes, healthy eating recipes. This is a new year. It's time to enjoy this step going forward to improve your health, your lifestyle and your well-being. Have fun with it and enjoy.
So exercise is really important for weight loss, and it doesn't cost anything to come out for a nice walk, and it doesn't have to be that far.
Everybody's capabilities, mobility issues are going to be a little bit different, and the great thing is if you utilise the resources in your leaflet, as Liz said, just having a walk around the block, just getting out, getting that fresh air. We're coming into the spring now. There's easy exercise options for at home if you are limited with your mobility or any other issues. There's great programmes that you can follow, all with the aim of improving your health and fitness, getting you outside, and really starting to enjoy things and reaping the rewards with your health and your liver.